common and fixed station is this station. It is how to operative a theater list. How to make the theater list is very important topic and very, very, very common station in the exam. Okay, so we have principle. So anyone know what is the principle to make an operative list? You see the building, you see the slides or not? Okay, so when you make the operative list, what you looking for? Anyone?
You check the patient's pre-morbid first. For example, if the patient is having diabetes or requiring insulin therapy, then you may need to put the patient as a priority first because they are prone to
Yes.
hypoglycemia.
Okay, what else? Yes. What is the last in the list?
The dirty cases.
Dirty cases. Okay.
Potentially.
So this is fixed station. In each station, we have this station. So what is the principle? Is the principle, of course, you discuss with operative theater regarding the OT cases. So it is something routine. First morning list must be diabetic patient or children. Okay. First major operation can be first to avoid cancellation. And in the last list is the infected case like colostomy, diabetic food, MRSA patient, hepatitis, and AIDS. Okay, so this is the general principle. Of course, you discuss also you write in the list if this patient allergic to iodine, so we don't use bovidine iodine, which is antiseptic can use, so can use another one like chlorhexidine. If this patient have sensitivity to latex or rubber, you need to mention that. If this patient needs frozen section or histopathology, you consult or you contact the histopathology, inform infection control team if any infected case. Okay, so what happened in exam? In exam, we give you this list. We give you 1, 2, 3, give you name, number, date of birth, male, female, and like in this case, we have left inguinal hernia, abdominal aortic aneurysm, left varicose veins stripping and ligation. And the first patient have a pacemaker, second have COD, chronic obstructive airway disease, and the third one have methicillin resistant staph aureus. Both are male or are male, and all I think is old people. So what is the first case? So we ask you make an order for this list. So what is first? What is the last?
Suppose triple A should be the first, then followed by left inguinal hernia, and lastly the varicose vein stripping. I think.
Okay. Of course, varicose vein stripping is the last because it is MRSA. And the first will be abdominal aortic aneurysm. So you are 2, 1, 3. So start by abdominal aortic aneurysm, followed by left inguinal hernia is a clean operation, and last is MRSA or methicillin staph aureus with the same precaution. Okay. After that, I show you the list, but after that, you discuss with the examiner some related to pacemaker, some related to MRSA. So we discuss it later. So we have the same 3 patients. One is right hemi orthoplasty and he's diabetic, allergic to iodine. Second is above knee amputation is warfarin oral anticoagulant for AF and hepatitis. Third is a case of arthroscope and anaphylaxis to penicillin, and they ask you what is the first. So anyone have an idea? Which one is the first?
I think the right knee arthroscopy should be the first. Then the right hemi arthroplasty second. And the last one is the left, aka
Okay, so you start by 3, 2, and 1. Okay, the last one is what? Is
3, 1, 2.
say again, 3,
3, 1, 2.
3, 1, 2. Okay, 3, 1, 2. So you can see here. So it is 1, 3, 2. Okay, so we can see 1, 3, 2. 1, 3, 2. Okay, of course, 2 is hepatitis, so must be at the end. The first case is right hemiarthroplasty, insulin-dependent diabetes mellitus. So we start by it because this patient is diabetic. Forget allergy to iodine. And the last one, the second one is right hemiarthropathy. So here is one. First case, diabetic patient. Second case is the patient with knee arthroscope. It is a minor operation. And the last case is above knee amputation. Okay. After that, the examiner asks you some related to what we discussed now. Okay. So he show you the picture or sometimes the bottle, because we discuss one patient and say this patient is allergic to iodine. Iodine here is bovidine iodine. Which is this? So which solution used for skin preparation? And to show you 1, 2, 3. First one is bovidine iodine, hydrogen peroxide, and the third one is chlorhexidine. And ask you, in this patient who's allergic to iodine, which antiseptic solution you need to use? What is your answer?
Chlorhexidine, I think.
Yes, of course, chlorhexidine, because first, betadine or betadine or bovidine iodine is contain iodine, so contraindicated. The patient is allergic, so not use it. Hydrogen peroxide is not antiseptic. It is used for anaerobic organism in deep abscess, so it's not for preparation of the skin. And what we use is chlorhexidine. It is important to know this is called the skin preparation, because in some countries they call it sterilization. It is not a sterilization, it is just skin preparation. After that, we say the patient, one of the patient is allergic to penicillin. So if this patient allergic to penicillin, so which antibiotic you can give to him? Of course, I just bag this patient allergic to penicillin. What is operation he will did? So patient allergic to penicillin is knee arthroscopy. So it is just superficial operation, clean operation. So what antibiotic you need to give to him? Any simple.
If allergic,
Say again.
if allergic to penicillin, can choose clindamycin.
Can, okay, can clindamycin, but it's not common for a skin infection. We can use cephalosporin and vancomycin, but it is important to know that both penicillin and the cephalosporin act in the cell wall of bacteria, so sometimes they have cross sensitivity, so it is important to make sensitivity reaction to him. We mentioned that patient have chronic obstructive airway disease, so this patient, if they have chronic obstructed airway disease and have inguinal hernia, so what is the precaution? What shall we do for him before and after the operation? Sometimes you can ask, I will consult the anesthesia, or I consult the chest doctor or physician. And of course, this patient, if he or she is smoking, you need to stop smoking. If the patient take a medication or nebulizer, you need to be ready for that. So stop smoking at least 4 weeks. Respiratory exercise, you know that you found in Malaysia post-operative, the patient, most of patients have insensitive respirometer. Treat any associating chest infection. Of course, chronic obstructive airway disease can be complicated by pneumonia, which is chest infection, respiratory failure, or sometimes very rare lung collapse. Okay, it is important because if you see this patient of chronic obstructive airway disease, it is inguinal hernia, so it is elective operation. So you can stop smoking for 1 month. You can ask for physiotherapy of chest. You can make some training because it is not emergency operation. Okay. After that, we have one patient have an oral anticoagulant. I think this is patient, not this patient. We have a patient here. He will do left above knee amputation apart from hepatitis, but he has an oral anticoagulant or warfarin for AF. So what shall we do? This is not emergency operation. So what shall we do in preparation of this patient? And what is your guide? For example, to follow up the patient on oral anticoagulant by what test? If the patient in the oral anticoagulant, we follow up by INR. Again, this is not emergency operation. So what we will do, stop warfarin can be 2 days before the operation. You must measure INR, must be below 1.5 to avoid bleeding. Of course, you start Clexane, which is low molecular heparin. After the patient recover, after start eating, so you can restart warfarin 6 days post-operative if patient allow for oral feeding. So don't forget, follow up with oral anticoagulant by INR. INR is international normalizing ratio, and it is the ratio between prothrombin time and control. Back again, we have one patient, I think is diabetic. So one is insulin-dependent diabetes mellitus. She is a lady and have laparotomy for diverticular abscess drain. So again, for diabetic patient, of course, if the patient can on oral anticoagulant or insulin dependent is different, and is different, it is minor operation or major operation. If minor operation like the regional abscess and the patient in oral anticoagulant, nothing to be done, just to follow up the blood sugar. If something high, we can use insulin pump. But if the patient, like this patient, is insulin dependent from the start, so he will be on the insulin sliding scale. When patient allowed to eat, so if he's an oral oral hypoglycemic drug, he return back to oral hypoglycemic drug. If the patient on insulin, he return back to the normal dose of insulin. Because usually if the patient after operation, we give him Actarabid, which is aqueous insulin or soluble insulin. But usually the patient take a mixture between long-acting and short-acting, what we call it mixed start. After that, we have a patient have a pacemaker. I back again, which one have a pacemaker? So this patient, which one have a pacemaker? No, this maybe this one, insulin, diabetic, warfarin, anaphylaxis. We have another list, I think, yes. So first patient with left inguinal hernia have a pacemaker. So anyone, if the patient have a pacemaker, what shall we do?
If the patient is going for any surgery, if they are using
No, it is
diathermy,
inguinal hernia. Here is inguinal hernia.
or in the inguinal area.
Yes.
Preferably use a bipolar diathermy.
Okay, what else? So usually it is correct. In surgical point of view, with bipolar diathermy, we don't use the monopolar diathermy. We take a precaution for pacemaker. But if you are in England, you miss something very important. Again, you need to have to know that you are general surgery, not cardiosurgery, not cardiology. So in this patient, I will consult the cardiologist to see the indication of pacemaker, what happened if this pacemaker is not working, because maybe not working to any cause, not due to the diathermy. And usually the cardiologist attends the theater, attends the operation, and they have something we call it external pacemaker. Okay, so it is important in MRCS. In some station, usually we tell the student you are not a hero, so you are not treat diabetes and hypertension and all disease. So put your mind, you have another specialty in the hospital. So first consult cardiologist. Why? Pacemaker checkup clinic. Usually this patient have checkup. What happened if pacemaker is not working? What is the indication of pacemaker? Of course, avoid monopolar, so use bipolar. Cardiologist with temporary pacing equipment avoidable during operation. So during surgery, the cardiologist must attend with you and also have something called external pacing or temporary pacing or whatever the name. And of course, it is important to check the anticoagulant status. Okay? So don't forget to ask the help of other specialties. Suppose I am in exam and I tell you, you have a patient with diabetic ketoacidosis, how to treat him. Okay, I will consult the medicine or the houseman or whatever in medicine. And of course, he will do like give intravenous fluid, give insulin, whatever. You have an idea what we are doing, but don't forget, you are not alone. You are not a hero in the hospital. Okay, because one of big problem in England is insurance and the medical insurance, and if you make a mistake, the family or the hospital take money from you or something like that. So here we mention avoid monopolar and use bipolar. So the usually in exam we give you this one and ask you what is this used for? And what we called it.
This is a diathermy pad. Usually it acts as the earth leg when
Okay.
you are using a diathermy.
All right. So actually, it is the diathermy pad. We called it patient pad. It is not called the earth blade. Although in my country, I am from Egypt, they call it earth blade, but it's not earthing. It is just to complete the circle. I don't know why this comes, this earth blade, but it is a patient blade to complete the circuit. And if you see this, it means that, okay, so the next question, here's a tricky question. He asks you, where you put the patient blade in bipolar diathermy?
You don't need the plate because it is a bipolar already, so it actually travels between the two legs.
Okay, good, excellent. So in this is patient blade used in monopolar diathermy, but in bipolar diathermy, we don't have patient blade because the circle is between the two plate is completed. If you see me now, the circle is in between the two plate of the forceps. You have a forceps to make the forceps like this, so it is the end blade of it. Okay. So back to the question. If the patient with a pacemaker, what type of diathermy you will be used? So it is bipolar. Where you put the patient blade? In bipolar, no patient blade. And ask you what is the normal size of patient blade used in bipolar? What is the normal size patient blade used in monopolar, not bipolar? Okay, so the patient blade, which is this, must be minimum 7 by 10. Less than that is dangerous. So again, this patient blade or diathermy blade is not earthing. It is complete the circle. We don't have earthing. and this is used for monopolar diathermy. Bipolar diathermy, we don't have earth blade, we don't have patient blade, we don't have this in bipolar diathermy. Bipolar diathermy usually used in end organ, like what? Like penis for circumcision, like digits, fingers, all this we use bipolar diathermy. Ear, ENT, so this is common use by ENT. Just for demonstration, you see this picture, if you have a circle like this, so it is monopolar, which is common use. If you know patient blade and the circle continuous by bipolar, so we call it bipolar by forceps. Okay. So diathermy is very important. This is very common, fixed, important station. After that, they ask you what is the complication of the diathermy. Any one of you, what is the complication of diathermy?
Diathermy burn, accidentally ignite the fire because of oxygen.
Okay, usually can make a burn, can make something, but it's not common, but can happen. Okay, so the common, I just need to share the screen again. So the common is, you can see here, diathermy burn. It is important to know if you have a precaution to know have a burn. Of course, if you use alcohol for cleaning the patient, you need to leave it till evaporated. The patient diathermy handle must be away, not used except by some surgeon or assistant. Avoid any metal in the body. All this can to avoid the diathermy complication. Of course, we don't use in circumcision, don't use a spermatic cord, we don't use monopolar in digits, in like hand, like fingers, like toes, like ear, like nose. In the past, we don't use it now. We can use ether, can cause explosion, not use it now. Spirit burn is common in England because you know that very cold weather, so evaporation of the alcohol take a time, especially in the umbilical area. Okay, so this is the end of this topic. So it is important to know this is fixed station, look easy. And what in this station is aim is just to have to arrange, have to set up the operative theater list, which is important. We end by hepatitis, colostomy, infectious, amputation, all these. We start by baby, by pediatric, we start by major surgery, we start by diabetic patient. Okay. It is important if you have anything, we ask the help of other, like patient have pacemaker, I will call, I will ask, I will consult cardiologist. Patient have infection, I will inform the infection control team to come with me and remove unnecessary machine in the theater, limited the number of person, make it at the end of the list. So all these precaution must be obey. Don't forget you are have another specialty with you. This is one of the fixed station, sometimes considered as communication skills or for procedure skill. So it is just like suture. We use it in IMU like suture station. So it is considered as clinical skill station. Any question about this? Easy station. It is easy to pass it. Okay, so operative list is very important. Second common station usually have an exam is called splenectomy in a child. And usually outside we give you scenario like this. Child, his name is Smith, 9 years old, admitted for splenectomy. This is emergency splenectomy. And the consent was signed by his father, his mother coming angry at this time, the child in the theater, and both parents are separated as the child father is drink a lot of alcohol. So this is social problem. Two separated, the child with the mother, but the father usually take him in weekend. Suppose he go to garden, he drop from something and have injury for his abdomen, and the doctor decided to do splenectomy. So what happened? What you see in exam, you see the mother. Usually the mother is not. It is actor. We use some professional actor, and she become angry and ask you what happened. So what happened? Okay, so you just tell her the baby or the child or Smith come by his father. He is have accident in the garden, and we have usually you have the vital signs. You have a blood pressure or hemoglobin is drop, blood pressure is drop, and we decided to make splenectomy. So mother ask you first question. I will ask you in behalf of her. So suppose I am the mother. So why you are not asking me to consent? Why you take a consent from a father, or what you don't wait me till I came to take a consent from me? So what is suppose your answer? Or
So
why you don't?
any legal guardian is allowed to sign the consent on the child's behalf.
Okay, but why you don't wait me till I will be arrive? Suppose the father is not here, so why you don't wait here till the father is arrive?
Because this is a surgical emergency.
Okay, so our question is: this patient need someone to sign a consent or not?
If it's a surgical emergency, no.
Yeah.
And just
So
proceed.
you just tell her first it is a surgical emergency, and sometimes in surgical emergency we don't need someone to sign a consent. So this consent usually signed by two consultants. That's it. But because his father is present, so we just explain to him the situation. So we don't need to wait till you arrive. So the mother tell you usually his father is drinking, and this is because this is why we are separated. So at time of sign the consent, he is drinking. He ask you who? What is your answer? Suppose you are not the doctor who attend with him, sign the consent. You are another doctor. What is your answer? Anyone? Isn't actually the answer? Yes, yes.
If the father is intoxicated, the consent shouldn't be valid.
Okay. So suppose you are not taking the consent. So tell madam, because we take a consent, so must be this is the patient, this is the father have full capacity to sign a consent. Because if he's drinking or he's unwell, we don't ask him to sign the consent. So here we have two issues. This is young emergency situation. We don't need anyone to sign a consent. But if she asks why don't wait me, of course, even his father is not here, we can proceed to the operation. And the second thing, his father, of course, is the consent is taken by my friend or by other doctor. But once we take a consent, we confirm that the patient have full capacity, and it means that the patient is oriented and have a capacity to sign the consent. So who is doing the operation? Are he expert or not? Of course, in the scenario, we don't tell you who makes the operation. So don't give knowledge you don't know, but this done by one of our consultant, and he's expert in this type of surgery. So sometimes if we don't give you something in the scenario, like we don't say Dr. Ismail, he will do the operation. So don't ask, don't tell her, I will do the operation, Dr. Ismail do the operation. It is one of our team or one of consultant or our consultant, and it is expert in this type of surgery. So the patient after that ask you, what is spleen? What is the function of the spleen? What is spleen? It is important in exam because some people exam is not a slang English, so don't say stomach means abdomen, because it is very common in some country. We found we put a tube in the like for example laparoscopic surgery, we put a camera in your stomach. So even this is medical exam, this is clinical exam, this is we examine also your knowledge. So forget that the lay England or the lay British people say the abdomen is the stomach. The abdomen is abdomen, stomach is his organ. So he asked, where is the spleen or what is the spleen? The spleen is organ in the left part of the upper part of the left side of the abdomen. What is the function of spleen? It is have many function. He have some sort of immunity. He can what's called get rid from the platelets and RBCs, have a storage of the blood, and it is important have some immunity. It is immunity against bacteria, especially encapsulated organism. So the mother asks you how to know the spleen is injured. How do you know that this spleen is injured? Anyone?
Fast scan only suggests bleeding.
Okay, so first we found the blood pressure or blood pressure is drop, hemoglobin is drop, and we do fast scan, we found some free blood. But how to confirm that spleen is injured? So how to confirm? By CT. So, you know, injury of the spleen is 5 degree, and we remove the spleen in the 4th and the 5 degree. You see the PowerPoint now, or shall I say it again? You see it. So we have grade 1, 2, 3, 4, and 5. 4 and 5, you must remove the spleen. 1, 2, 3, you can preserve the spleen. So how to know? We suspect it because the blood pressure, the hemoglobin is drop. We have fracture, for example, or tender in the upper part of the left part of the abdomen, and fast scan show free fluid, and to confirm it by computerized tomography, and it is grade 4 and 5. Okay? So the next question, if you open, you can save part of spleen or you remove the spleen totally. What is your opinion? Usually in most of the case, yes.
Usually in the case of a trauma, it depends on whether it is grade 4 or grade 5. But if it is grade 5, we have to remove the entire spleen. If it is a grade 4, you should usually have to remove the spleen. But if there are any remaining like spleen unculi, we may be able to we may attempt to reserve the spleen unculi.
Okay, so we will try to preserve the spleen, but if it is complete damage like grade 4 and 5, I think it's better to remove it. Okay, so the mother asked, after you remove the spleen, is my baby or my son is become handicapped? He can go to school or not?
Yes, he can continue the daily activity in the schools. He can still continue to play sports and also do other activities like other normal children. The thing about the thing that we take out his spleen, it means that he is losing some immunity function. So in order to prevent him from getting infection, he has to take a lifelong antibiotics, which we are giving him a penicillin antibiotic. And at the same time, he needs to take aspirin every day so that he won't have any heart attack or any cardiovascular related problems.
Okay. You know, in the last exam, most of the students tell about lifelong antibiotic. But this is very old policy before vaccination. Nowadays, if they give a patient vaccination, what we call the triple vaccine, which is pneumococcal vaccine, meningococcal vaccine, H influenza vaccine, we don't need to give the patient long life antibiotic, but we give the patient prophylaxis antibiotic as any surgery, like hernia, like whatever surgery, like gallbladder. So long life antibiotic nowadays is not recommended. Aspirin also is not recommended. So what we give vaccination, we give prophylaxis antibiotic as any surgical operation, and after that, no problem. Why we give vaccination? Because the capsulated bacteria have something called opsonization, and this opsonization is a function of the spleen. Okay? Don't say lifelong antibiotic. It is very, very old policy. Although it is common in books. Okay? The mother asked, why you don't remove the damaged part only and stop bleeding? Can you remove part of spleen and leave the other? And she asked you also, is any alternative for surgery? Of course,
No, there won't be any alternative.
No alternative of surgery. It is, you know that this is mother is not in medical field, but no alternative of surgery. And if the spleen is completely damaged, we must remove. If some part sometimes can have partial or segment splenectomy. For me, I don't agree with that, but I found in some books they say, okay, sometimes maybe segment is avulsate and the other part of spleen is correct, so we just remove make something like partial splenectomy. I think it's not common to be done, but is okay. After that, of course, no alternative. So still the mother, he asked, is the father drinking at time of consent? She asked again. So again, the answer, if he is drinking, we don't allow or we don't ask him to sign a consent, and we go to straightforward even because his signature is not necessary as this is emergency operation. And of course, you explain to her the blood pressure is drop, fast scan on ultrasound show free fluid and confirm it by CT. Okay, so the mother ask you because we suppose you met the mother in the emergency room and ask you where I wait now, what shall I go now? No, you are unmuted. The mother ask you, you are met the mother in emergency room and tell her, she ask, can I see my baby or my child? No, because he's in theater. So where I will stay now? So she will waiting area in front of operative theater. So you will stay in the operative theater area and waiting area. Of course, you're not allowed to enter the operative theater. So we have waiting area in the operative theater. It is again not a recovery room. So don't tell you stay in the recovery room. In the exam, because I attend this station many times in different country, India, Malaysia. So we found some students speak about we give a special card to the baby, which is not true. We don't have a special card for baby have splenectomy because it is not like thalassemia can have, hemophilia can have some blood disease, but after splenectomy, we don't give a special card. Usually, sub-student or the patient you know, the patient usually, or the mother of the child, usually have many scenario according what is your response. So some students, they ask about detail, why you are divorced, because he's drinking, he's not take care with my son. So what is, if you go to this issue, so what is suppose your answer? So doctor, this my ex-husband is not good, he's drinking and he don't take care with the child, and I need to not allow him to see the child or remove the custody to see the child in the weekend. So what is your response?
Please consult the lawyer.
No, not lawyer. In England, they have some called social service. In any hospital, they have something called social service. Or sometimes you have child protected service, but it is under social service. So, okay, we tell the social service people so they can communicate with you. So anything is not related to medicine is not your job. You understand? If he ask you something, okay, so we ask the social service. By the way, I know the culture here or my country is different, but I tell you from experience in England, social service can do, for example, patient came in accident and say, I go to bring my son from the school. He is in, for example, Birmingham Primary School. So the hospital ask one of social service, he can go and bring the child from the school. Or he patient say, I left my dog in the house and no one attend and will stay because I have fracture. I will stay in the hospital for 1 week. So the what happened? Social service go to the home, bring the dog and put in special nursery or special place in the hospital. So the social service in England, not like in other country, they have many role, like can contact social affairs, child protection, uh, can discuss with the father, but not the doctor. Just to know that we contact social service, we make a note in the social service of the hospital, and they will manage to do that. Okay. So this is the first station in communication skill, is how to communicate with angry mother or angry relative. And again, it is important to know this is station. We don't ask you question. We don't interrupt you. The question is asked by the actor. And this is actor who give her all possibility. Like why he signs the consent, why you don't wait me. So you need to tell her, okay, we don't, it's not wise to wait you because this is emergency operation. All right. Usually the examiner not interrupt you. Sometimes usually not ask you anything except if you come something very strange or you ask her something abnormal. Of course, again, we don't allow her to enter the theater. We don't allow her to go to the recovery room. She's just waiting in the waiting area in front or attached to the operative theater. Okay. This scenario is very common, and most of the actors become nervous because they need to simulate the scenario, because usually this is second class actor. So usually he need to become professional. So don't worry if the patient shouting with you. What I see in the actors, because I see actor in different countries, some actor standing. So you made the patient, you found her standing. Where is my baby? I need to see my baby. So once the patient is standing, the relative is standing, you're still standing. But ask her to sit down and sit down after that. You can give her water, you can give her tissue, but don't say I tell you something serious, because she in this situation he considers the serious condition is her son is died. Okay, he's in best hand, he's in theater now. So have a seat. We don't allow you to enter the theater. I tell you what happened. And after that, after come out from recovery, you can see him or visit him in the ward or the intensive care. Okay. Of course, during this scenario, eye-to-eye contact, you need to stand like this. Don't hesitate. You need to be sharp. And if they ask you something not in the script, who did the operation, he's expert, yes, he's expert, he's one of our, or our consultant, or one of our team. Okay? So this is the end of this scenario. Any question? Okay. Next week.
Sorry, doctor,
Yes.
Sorry, doctor, just to ask, do you tend to see the actors tend to shout or tend to like he or she will try to make the things intense, like doing some other fiddling actions? Maybe
I tell
try
you,
to see how you react.
in Malaysia, the life is easy because we use our student. You know, we have exam next Friday, coming Friday in MRCB. So we use the actor as our student. Our last batch, I think one of them is Hing and the others. So usually the student is kind, but in some country or sometimes in UM, they bring an actor. You know, actor like work in movies. So this is actor. Usually he need to like make like he need to act. So that in India usually they are so aggressive. And last time what the actor looking to the candidate, where is my baby? Where is my baby? And after that, is he okay? And he told tell her it's okay. Once he said I will tell you bad news. He means the bad news is I have splenectomy. He shouting my baby die and something like that. Okay. But of course, they not injured you. They just simulated. But it is important to be accurate. Like we don't hesitate. Are you sure the spleen must be removed or need to explore? Yes, because we look in CT, the patient blood pressure is drop, and the spleen is a soft organ. All this. Okay. Don't say we open and see maybe remove or not removed, because if you open, at least to remove a part, because you have a bleeding. Of course, in liver, in other organ, you can have repair, but in spleen, some put a mesh. We have many alternative, but it's not common to be done. Okay, next week we have another scenario, which is the common, is the phone call. How to call the consultant in phone call. We usually advise the student to just make a call to Grab Food or KFC and see how they communicate, because the ideal in communication skills. Don't forget, which is forgetting by most of the student, is to summarize before the end. Before the end of the call, you summarize to the consultant or summarize to whatever you call him about what we decided to do. And again, when you make a phone call, suppose the patient have a hemorrhage or bleeding. So the first thing you need to come, because this patient have, for example, impending rupture of aorta or rupture of aorta. Don't talk a lot, and at the end, I think it's better to come. So you start by this serious condition, this patient have aortic aneurysm. So we'll give you some scenarios, and also we show you submandibular swelling and how to discuss submandibular swelling. Last time I attended, because I attended the exam 1 week, 1 month ago in Hyderabad, and 2 months before in Malaysia. We have the submandibular case. We don't manage to have submandibular patient, but we bring normal patient. In the last exam in IMU, we have submandibular swelling also, but we make like redness by moulage, like makeup. Okay, just mimic swelling. But in IMU, in Royal College, we don't make makeup. We just say this patient have pain, but I tell him you are lucky today, the swelling disappear. Okay, but examine the area. All right. Good luck to all. I hope very okay. So we try to make this course continuous. We plan in IMU to make a face-to-face clinical skill like suture and other. So we try if we have enough number, so we can make it in Bukit Galil, but we can discuss communication skills and anatomy and physiology and pathology. Okay, good luck to all and nice weekend. So meet you the same time next week. Jum'at Friday. So is the last link is working or not working? I sent it to the WhatsApp group.
The last one is working.
Is working. Okay, so use it. I make it repeated. Okay, all right. Good luck. Thank you. Waiting, you still the top in Malaysia, by the way. Your score is 244. Another one is 242. So you still the highest score in Malaysia. Okay. Good luck. Good luck all. Goodbye.
See you, doctor.
Thank you.
Thank you, Dr. Shering.
Thank you.